TLX, basically it behaves and acts like a BLX. That's more or less what the surgical impression is. It's the same drill protocol, it's the same insertion tool. Again, I'll go back to the thing about immediate treatment protocols. It's not the only solution. We don't have to use immediate treatment protocols. And this implant is not only for immediate solution. It just offers you a very simplified drill protocol. It's easy to achieve the primary stability. Either you load it or not. Either you place it in unmature bone or in healed site. You don't have to go immediate. You can use this implant and you can adapt your techniques in your traditional way, and then you might increase your knowledge and expand your toolbox to do this more on an immediate level in the next phase. And it's all about the patient experience in the end anyway, because if we can reduce the amount and the number of surgeries we do and reduce the treatment time for the patients, we're doing a better job. So the advantage of having a bone level and a tissue level system that offers all the flexibility using the same instruments and the same connecting system and the same insertion tool offers at least a little bit less logistics within the clinic. My nurses love that we now have one cassette for all of these things, and also the stockage of components is much more easy for us.